Hello, this is Dr. Denny again. I wanted to share with you a stretch and an exercise that's going to help you to restore the curve back into your neck. Now, if you look at this spine right here, this is a spine looking straight from the side, and they're pointing this direction. What you want to see, and most of you know this if you're patients already, you want to see the nice good curve that's going forward in the neck. In the upper back it goes backwards, in the lower back it goes forward. A lot of times when you think of pillows are designed, a lot of these contour pillows are designed to support that curve in the neck. If you think about in your car, a lot of people's car nowadays will have something that will push forward in the lumbar spine or the low back that will help support that curve in the low back, and oftentimes that will help prevent a lot of pain. Now, what I want to do is show you a stretch and exercise that's going to help restore this. It's essential to get this back because that's going to give you the spring that we need to protect your spine down the road. Now, first things first is you want to stretch it out. So when you start as a patient, we have to get the spine moving first. So with your adjustments, you might be in pain, you might have stiffness, you might have tightness. With the adjustments, we're going to actually get all of your joints moving better. That way you'll have some flexibility. Once you have that flexibility, then we'll add a stretch to it. Now, you can use a neck roll. We have these in the office. They're pretty cheap. You could also use a swim noodle if you get the right size. I've seen swim noodles this big. I've seen some that are this big. So this is about 3 inches in diameter. Now, another thing that you can do as well, you can also use a rolled up towel. Now, the important thing about the rolled up towel is you don't want it to be this real soft, cushy towel that when you roll it up to this size, it just squishes completely flat. You want it to have some resistance so it'll actually push up on your neck and stretch it. So what I'd recommend is to use this, and I'm going to show you how to do it in just a second. I'd recommend to use this until you can get to 15 to 20 minutes where there's no problem. Now, you're not having soreness, you're not having any discomfort. I would start out very, very slow. I'd start out maybe a minute at a time and then slowly work your way up. Some people jump straight up to 15 minutes. It's up to you, but again, you could get sore from this exercise or from this stretch. So what I'm going to do is I'm going to actually show you how to use this. Again, it's very, very simple. You're just going to lay on your bed and you're going to put it right behind your neck so that your neck will curve over the top of that towel or over the top of this neck roll. Now, also the very important thing to do is to put it so it's actually in the way when you're going to bed. A lot of patients actually know they should do it and they actually feel good when they do it, but they forget about it. They forget to do it because they usually stuff it in their drawer, they stuff it underneath their bed. I wouldn't recommend doing that. I put it in the way so you see it every single night. That way it's always consciously to your memory because you're trying to develop a new habit with this. So what you're going to do is you're going to lay this on your bed and then you're going to lay right back on top of it just like this. Very, very simple. This is all you're doing. You might actually get a little bit sore from this. Sometimes I like to even roll my neck around to help loosen it up. If you get to where you're sore, all you do is just take it out, grab your regular pillow, and you're good. But it's totally up to you how fast you do it. But again, like I said, once you get to where you're doing about 15 to 20 minutes, 15 to 20 minutes of that, where it's no problem at all, then you're ready to do an exercise. What that exercise is, I'm going to show you in the next video, but that exercise is actually puts your neck into that curve, which I'll show you how to do that. And then what you're going to do while you're holding that neck in the curve, you're going to strengthen all the muscles around that because ultimately your muscles is what's going to hold that in your place, and then your ligaments are going to start to tighten around that as well. So work on the stretch first. Once you get to 15 to 20 minutes with no problem at all, then you'll start to do the exercise. In the next video, I'll show you the exercise. Thank you.